Hello everyone, welcome to a new episode of MemoMap. Today we are going to simplify the cardiac cycle in a very organized way. We will cover five main parts. First, we will discuss the general overview. Second, we will talk about the basic structure of the cardiac cycles in much more details. And then we are going to talk about the important volumes and the cardiac parameters, and last we are going to discuss the pressure volume relation curve. So let's start with the general basics informations. Let's begin with the definition. The cardiac cycle simply is the event occur from the begin of one heartbeat to the begin of the next heartbeat, and it's generated by the SA node, which is acting as a pacemaker for the heart. So, what about the cardiac cycle itself? Has two main parts. First, the diastole, in which the heart is relaxed, so the ventricle filled with blood. It's longer than the systole when the heart rate is normal around 70 beat per minute. The systole is when the ventricle contracts, so the blood is ejected to the arteries. Please remember and important that the duration of the cardiac cycle is affected by the heart rate. So when the heart rate increases, the cardiac cycle becomes shorter. However, the diastole becomes shortened but not the systole. So diastole become equal to the systole, and accordingly the filling time will decrease. Now let's talk about the heart valve. We have two types of the heart valve, the AV valve and the semilunar valve. The AV valve are mitral and tricuspid valve, and they allow the blood to flow from the atrium to the ventricle, and their closure produce the S1 sound, while the semilunar valve are the aortic and pulmonary valve, and it allows the blood flow from the ventricle to the artery, and their closure producing S2. The valve depend on the pressure gradient. It's important to note that the forward pressure always open the valve while the backward pressure close the valve. Let's give a simple example. If we want to open the AV valve, the atrial pressure should be more than ventricular pressure. And if we are going to close the AV valve, the opposite is correct. The ventricular pressure should be more than the atrial pressure. The same apply for the semilunar valve. If we want to open the semilunar, the ventricular pressure should be more than the arterial pressure. If we want to close the semilunar valve, the ventricular pressure should be less than the arterial pressure. And now let's talk about the 6 phases of cardiac cycle. In diastole, we have 3 phases: the filling, rapid and reduced, and the atrial systole, while in the systole we have the 3 phase also, isovolumetric, and in between ejection. So in diastole we have the filling phase, rapid, reduced, then the atrial systole, while in the systole we have isovolumetric contraction, ejection, and isovolumetric relaxation. Let's talk about each phase in more detail. First, start with the rapid filling phase, where the AV valve are open, the blood flow quickly into the ventricle, and both the atrium and ventricle are relaxed, and the filling become more slow as the pressure gradient decrease. The atrial systole, in which the atrial contract to add the final 20% of the blood. Remember that the filling phase is responsible for the filling of the ventricle passively with 80%, while the atrial systole is responsible for active filling of the heart, and it's responsible only for the 20% filling of the ventricle. The B wave, which represents the atrial depolarization, which means atrial contraction, usually occur in the late diastole where the atrial systole occurring. Let's now talk about the three phases of the ventricular systole, starting with the isovolumetric contraction. All valves are closed, the volume is constant, the pressure rises rapidly. Remember, isovolumetric means a constant volume. For constant volumes, it means there is no blood enter or move out from the ventricle, so the valves are closed. And since the ventricle contract and the wall on the tension, wall tension increase, so the pressure inside the ventricle rise rapidly. The QRS complex represents this phase since the QRS is a ventricular depolarization, which means a contraction of the ventricle which occur in this phase. Also, the closure of the AV valve occur at the beginning of these phases, so S1 is here too. This ejection phase is started with the opening of the semilunar valve, and the opening occur when the pressure in the ventricles more than that in the atrium, and this is the main aim of the isovolumetric contraction phases. The blood ejected from the ventricle to the vessels. About 60% of the blood in the ventricle is ejected from the ventricle to the vessels and start fast, and then the ejection becomes slow by time. Finally, the isovolumetric relaxation, also here isovolumetric, so the volume is constant, the valves are closed, and the ventricle here only become relaxed, and the T wave represents these phases or occur before these phases, because T waves means the repolarization, which means the relaxation of the ventricle which occur during this phase, and the closure of the semilunar valve which occur at the beginning of these phases is responsible for S2. So the ventricle pressures decrease markedly at this phase till it become lower than the atrial pressure, so the AV valve open again and the cycles begins. So remember that in the diastole we need to fill the ventricle, so always the atrial pressure is more than the ventricle pressure, and the volume of the blood inside the ventricles rise gradually, and the AV valve is opened. B wave occur with the atrial systole. Okay, and now let's move to the systolic phase. And in systolic phase, our aim mainly to increase the ventricular pressure first to be more than the arterial pressures, and for this we have to close all the valve, so the ventricle contracts, so the pressure in the ventricle become more than the atrium, also more than that of the arteries. And then the valve of semilunar open allow the ejection of the blood from the ventricle to the arteries, and in these stages the ventricle volume start to decrease gradually. And lastly, the valve closed, and now we need to decrease the pressure in the ventricle to be lower than that of the atriums. And here, when the all valves are closed, the ventricle should relax it to lower the pressure so it becomes lower than the atrium. Now let's focus on the important number you must remember. First, the end-diastolic volume, which is the maximum blood in the ventricle during the end of the diastole, and it's around 120 milliliters. Second is the insystolic volume. The blood remains after the contraction, so it is the minimum blood stay in the ventricle at the end of the systole, so it's almost around 50 milliliters. The stroke volume is the blood ejected per beat, so stroke volume equals the end-diastolic volume minus the insystolic volume, which is around 70 milliliters. The ejection fraction is a percentage of the blood ejected, how much from end-diastole come from the heart to the arteries. So it is around 60%, and it's equal the stroke volume over the end diastole, and it's important indicators for the heart function. And finally, let's understand the pressure volume relationship. And this curves show the pressure changes with the volume inside the ventricle. And it shows the four phases. Phase 1, the filling phase, where the volume increased from 50 to 120 milliliter. Pressure increased slightly. The phase 2 is either volumetric contraction. Here the volume is constant around 120, but the pressures rise sharply from 50 up 80 millimeter mercury. And here remember that all valves are closed. Then phase 3. For phase 3, which is ejection, to occur, the semilunar valve, the aorta or pulmonary, open, and the volume start to decrease gradually from 120 back to the 50, and the pressure slightly increase above the 80 could reach up to 120 millimeter mercury. And then the last phase is the isobarimetric relaxation, where the volume is remain constant around 50 milliliter, and the pressures start to fall rapidly from 120 back to the normal diastolic pressure in the ventricle. And in this phase, all the valves are closed. And now you have a full picture of a cardiac cycle. We started with general information defining the cardiac cycle, emphasize that it has two main parts, which is the systolic and the diastole, and always the diastole is more than the systole when the heart rate is normal. And then we discuss the difference between the semilunars and the AV valves. And then we discuss the 6 phases, in which the diastole we have 3 phases: rapid slow filling and the atrial systole, and the ventricular systole we have iso in between ejection, isovolumetric contraction ejection, and isovolumetric relaxations. And here we talked about the pressure, the volume, of the ventricle, the valves, whether AV valves or semilunar valve, the ECG, and the sound. Then we discussed the different volumes, the definition of the end-diastolic volume, the end-systolic volume, the stroke volume, and the cardiac output and ejection fraction. And finally, we end with the study of the pressure-volumes relationship. It shows the relationship between the volume and the pressure in the ventricle in 4 main phases. First, the filling, then the isovolumetric contraction, then the ejection, and finally the isovolumetric relaxation. That's all for today. See you in the next MemoMap.